Oops. Well, good morning. It's a great honor to be here, and I want to thank the Institute of Medicine for inviting me to be part of this panel and tell my organization's story. So I'm going to talk about the journey that the Massachusetts Health Quality Partners has been on to increase patient engagement through public reporting of performance information. And it's a journey that we've been at for quite a while. First, I'll tell you a little bit about our organization. Our mission is to drive measurable improvements in healthcare quality, patients' experiences of care, and use of resources in Massachusetts through both patient and public engagement and through broad-based collaboration. And MHQP has been in existence for over 18 years. We are one of the oldest regional health improvement collaboratives in the country. Our commitment is to provide health information you can trust. The last panel talked a lot about trust. I'm going to mention trust a lot. It's really key when you're trying to get people to do something with information, and also allowing when you use information to share with other people. So we have a dual mission, and that is to provide trusted information to physicians so they can better improve the care they provide their patients, but also provide this reliable and trusted information to the public so they can better inform their decision making. And sometimes there's a tension between those two, and the story I will tell will show a little bit about some of those tensions about this. So MHQP, our governance is one where we're a nonprofit organization. We bring many stakeholders together, basically people who provide care, people who pay for care, people who receive care, and we have our structure includes a physician council. We have very strong relationships with our physician community, and we've had a physician council for more than a decade, and which has helped us build up the trust in the community because we want the physicians to use the data that we provide to them. We also have a health plan council. The health plans have been a major funder of a lot of our core measurement work. And just recently, in the last 18 months, we developed a patient and public engagement council. And this was a result of our board realizing that we're not going to make the improvements in our mission unless we add patient and public engagement. We're just not going to get there. So while we've had consumer representatives on our board for the last decade, we felt it was important to raise sort of the consumer involvement and set up a council on par with our physician council and our health plan council. And so we have this new council, which is members are on our board, our executive committee. Every single working group that we have now has patients participating in this in equal footing, and that's made just a tremendous impact, and it helped influence the success of our partnership with Consumer Reports that I'm going to mention in a minute. So in terms of our track record, we've been national pioneers in publicly reporting information. On the patient experience side, we've reported 4 different cycles. We report every other year on 500 primary care practices in Massachusetts. We have a survey, a patient experience survey based on what the Institute of Medicine has said is important in the visit between the patient and the primary care physician. We look at communication, integration of care, knowledge of the patient, health promotion, and we also look at some organizational issues around access, visit-based continuity, and how the office staff, how they treat the patients. And this is a huge survey. We have results from 65,000 patients in Massachusetts. These are commercially insured patients. So this is incredibly reliable and robust. And we feed it back to our physicians so they can improve the care, as I mentioned, but we also make it public on our website, and it has been public since 2006. We also report on clinical data using HEDIS measures at the medical group level for over 150 medical groups. We've done that since 2005 on over 30 measures. And so on our website, you can find both of these reports about our physician. And here's just a quick sample of how we currently report. I will say we're part of the Robert Wood Johnson Aligning Forces for Quality communities, and there's funding for us to update our website so it's more consumer friendly. So in the fall, it will look much more like Judy is saying and Shoshana recommendation. But this is the website that we've had. We rate groups. This is hemoglobin test and cholesterol testing, how they perform. This is a patient experience survey, how well doctors communicate with patients, how well doctors coordinate care, how well doctors know their patients, how well doctors give preventive care and advice. So again, this is what was currently on our website. And this really helped motivate physicians to improve. We've seen solid improvement since we've been issuing and publicly releasing this survey on all of the dimensions of care. This is for adults, but the pediatric situation looks quite similar. So physicians really responded to this data. So it's fair to say that in the early stages, we focused on physicians because they were responding to the data. The patients benefit because the care is getting better, but we've been disappointed in the patients' interest in our website and their hits on our web. It just hasn't been as good as we hoped. Given our patient and public engagement strategy, we felt it was really important. We want patients to use this information. And we knew that MHQP will never be a household name, so our board, as part of the strategy, said we should partner with a consumer organization. So we partnered through a number of dialogues that happened over a course of 2 years. John Santa and I began talking, and we agreed to work together and jointly publish our information in the Consumer Reports insert in Massachusetts, and this was a pilot funded by Robert Wood Johnson. And so, and the idea why we teamed up together is that we have really reliable information, as we've said, on physicians, and we want to share it. Consumer Reports has a 75-year history in sharing information with people in a way that helps them make decisions. So, for the idea of, if I'm going to go buy a humidifier, I don't know what to look for. Consumer Reports will tell me. So if you're going in for a physician visit, many of us don't know what to expect in terms of, how well what the communication should be like, how well our care should be integrated and so forth. So that was an important feature. Both organizations really value sound data, and through Consumer Reports, MHQP was able to reach hundreds of thousands of Massachusetts residents who are Consumer Reports subscribers. There's 120 subscribers in Massachusetts. So this is what the ratings look like in this insert. This is in the materials that you have based on the web. And so this, as Judy and Shoshana said, presentation matters, but this was also incredibly contentious. Some of our physicians had a visceral reaction saying, I am not a toaster, I am not a refrigerator, I do not belong in Consumer Reports. And the sort of reaction to laugh, but this was intense. John can tell you, this is where my bargaining came in, I think he's talking about. So it was a feeling that it diminished professionalism. So we have a problem here. If when putting data out to the public in a way that consumers can understand is an affront to physicians' professional sort of integrity. I mean, that's where, that was the space we were navigating. And when I say physicians, it's not all physicians. I mean, clearly some physicians said, get this MHQP data out there. There's so much garbage on the web. It's horrendous. We really need some trusted information. But others just said, you have no right to do this. So we did it. We using the Consumer Reports presentation, but in addition to that, we also had an editorial part of the magazine, not the ratings, but this is where the story was. And this was really where we were able to really focus on, this was an opportunity for educating the public about improving their patient-clinician relationship, and that's what we sought out. We didn't look to say, go find a new doctor. It was more, how to improve your current relationship, what can you do as a patient to help improve your own care, providing information about a good fit rather than look to switch a doctor. So all this surrounding, the editorial surrounding this was really important. And we provide systematic scientific data, and we had practice improvement stories. So all of this was really important as part of this. So just as a quick example, how well your physician communicates with you. This Consumer Reports took the questions that we ask on the survey. How often did your doctor explain things in a way that was easy to understand? And so as you're reading this, you're saying, oh, how often did they explain things away. And then you see in Massachusetts, 80-40% said always. And then what to do to, so you can improve this. Take detailed notes, repeat your doctor's instructions back to them to make sure, the words got you right. If you're confused, say so. I'm watching this clock here. So the response was really, the public was terrific. Here's just some quotes, both from Consumer Reports surveys and comments we got. This is what transparency looks like. This was an outstanding public service. Thank you. So what? So Massachusetts residents have a new resource to help choose the best primary care practices. It's a milestone in providing consumers with valid, reliable, useful health information. Let's hope consumers take advantage of it. So just in terms of quickly, we sent out to 120,000 Consumer Reports subscribers. We had 2,500 hits on our website. Our Facebook went up 700%, Twitter went up 200%, and there were about 4.5 million sort of hits on the stories based on the work Chuck and his team looked at this. So in terms of the impact, I'm actually going to switch to lessons learned because I only have 50 seconds left. But the news sales went up 110% of this magazine. So lessons learned, there's a tension, as I mentioned, between how physicians want data publicly reported and how to present the data in a way that's actionable. Patients want to emphasize differences so that you have a meaning. Docs want to minimize differences. Patients want good or bad, and docs don't want anything to do with judgmental. Consumer Reports says we name names as opposed to focus on improvement. Looking at overall scores versus preserving details, the consumers want one. And so we really do need to publicly report data in a way that's going to engage the public, but we also need to be sensitive to physicians' concerns because, we build our trust on that, and we need to be able to, physicians play such a pivotal role that we have to keep their trust, and I think dialogue is the way to do that. So, thank you.